Hi, this is Dr. Beth Goldstein from Central Dermatology Center. Thank you so much for allowing me to care for you. I want to go over with you the Mohs procedure and what to expect. The Mohs procedure is typically reserved for areas of the body where we need to preserve healthy, normal skin as much as possible, such as the head, neck, hands, and feet, sometimes the shins as well. And this procedure requires you to come into the office and have numbing shots like you had for your biopsy, and then to sit and wait while we analyze your tissue. So Mohs means that I remove the tissue and I also am the pathologist to read your tissue. Once we know that your cancer is clear, then we will be able to discuss with you options for closure or letting it heal on its own or otherwise. However, the risk of the procedure that day, the main risk is bleeding, and we ask that you go home and take it easy. Please clear your day. Do not plan to do anything else. With bleeding risks, things like exercising, leaning over, any type of straining can increase your risk of bleeding. If you were to experience any bleeding, you would take gauze and you would hold firm pressure for 15 to 20 minutes without looking. So if you're dabbing every 30 seconds, it won't clot. So you need to press really hard and not look. If it's not stopping or you're not comfortable, please just call the office. The answering service will reach me if it's after hours. The other risk is infection. Any increasing pain is a sign of infection. Every day should feel better. If that is not the case, you need to call me. If you're not sure if you should call me, you should call me. I want to know if you're having any concerns about your wound whatsoever as soon as possible. Also, there will be a scar. There's no way I can cut on you without leaving some type of mark. We do try to minimize it through the Mohs procedure, but if you are unhappy with your scar, please let me know, but there definitely will be one. There's also a tiny risk of recurrence, and you do need to be monitored every 6 months for a few years, and then thereafter, depending on your regular referring provider's recommendation. Depending on the site of your cancer surgery, there may be some additional risks that I will review with you in the room. Please let us know if you have any sensitivities to iodine, adhesive allergies to tape, and any other concerns that we can help make this process as easy as possible for you. Thank you.